And the other thing that you get is the parents that, you know, go to their therapist and they will sit in the weight room on their phones and hope the therapist, the doctor, will
Mm-hmm.
cure their child.
Mm-hmm.
And let's talk about that because it's not going to happen without their involvement and their training and their willingness to be vulnerable and open.
Right. So the way we want to talk to parents about it, and what I want parents to understand, is that we're just trying to interrupt these patterns.
Exactly.
And if parents don't know what the patterns are, how are they going to interrupt them?
Right.
I often, it's funny because, and I'm a huge fan, a huge proponent, a huge creator of homework between sessions, right?
Oh,
It's an
me too.
active
Me
process,
too.
of course.
Yeah.
And I wonder, like, why is it in psychotherapy or that you're taking your kid to a therapist? Every other thing that you take your kid to, they're supposed to practice between, right? If you want them to learn the piano, the piano teacher doesn't say no touching the piano between sessions, right? The physical therapist doesn't say no doing your exercises between sessions. The occupational therapist says don't talk about this or don't do anything. But we as therapists say, well, we're not going to talk about this or
Right.
we're not going to do anything, right? It just is absolutely contrary to what we know is that with selective mutism, with social anxiety, with OCD, with depression, action counts. That we
Absolutely.
learn, the brain learns experientially. So,
Yes. And if you think about it, and you know this, and I explain this to families all the time, anxiety is about being out of control. You're out of control. And
mhm,
like a big part of the treatment, like for me, social communication anxiety treatment, it's a very CBT based approach.
mhm,
It's all about putting control back in their life and using
mm,
the exercises, the goal charts, the game charts for young children, the parenting goals. It's to help them unlearn their conditioned behaviors and accountability. And it creates inner control because you begin, and I know you talk about this because I was just listening to this on one of your podcasts, and it said about you change your focus.
mhm,
And so you're focusing on the games for the little guys and the goals for the older kids, and the parents are unlearning their conditioned ways.
mhm,
And yes, it's about accountability. So I struggle because when I see families that have often been from person to person, if they're traveling to PA from California or Europe or wherever, they've exhausted usually their local resources. And one
mhm.
thing that is almost, Lynn, universally missing is the accountability piece, knowing what to do, when to do it, how to do it, and where,
Mhm.
and
Yep.
really helping demystify this process. And I
Right.
love how you talk about that with kind of the demystifying this, that it's okay to be anxious. It's okay to be worried. You can name
Mhm.
your worry.
Mhm.
Talk to me about that because this relates to parents and kids.
Yeah. So one of the things it's interesting that you bring up this notion of control because one of the things that is inherent in anxiety disorders is there's a very low tolerance for uncertainty, a
Hmm.
very low tolerance for discomfort. So what I often see is that accommodations or patterns or practices, whatever you want to call them, families are doing these things in an effort to get rid of uncertainty.
Yep.
So there's often over planning and over
Hmm.
accommodating and over reassuring rather than saying to kids, it's really okay that when you step into a new situation that you feel uncomfortable, you're not supposed to know how everything is going to go. So there's this interesting balance between planning and then being flexible enough to manage when things don't go as planned. So it's sort of the analogy I use is that I fly a lot, right? So I'm going to the airport. When I go and do a talk or when I'm going to the airport, there's a lot of planning that goes into that. I can't just show up to the airport when I feel like it and be like, "Hey, is anybody going to Vancouver?" So so there's planning, but then things go wrong or the flight is delayed. Or the other day I was waiting at the airport and I was waiting for my black Toyota Highlander Uber, and the two first letters on the license plate were DV, and then there were some numbers. So I wait. A black Toyota Highlander pulls up. The first two letters on the license plate are DV. I get in. And about 2 minutes into the ride, the phone starts ringing. My phone starts ringing and his phone starts ringing. Well, there was another black Highlander,
Oh
Toyota
my
Highlander, with
goodness.
the license plate DV. I got in the wrong one. Now,
Wow.
right, so we have to solve this problem. These things happen all the time. Now,
Right.
what anxiety wants to do is make that into an emergency, but it really is a problem to solve. There are things that we can do that make things easier and harder. And we want kids to understand that as you step into new situations, socially, right? Social anxiety, SM, we're stepping into new situations. How do we tolerate the fact that we can't completely control what other people think, what they're going to say, how they're going to react? We sometimes can't control what we say. Sometimes we stick our foot in our mouth. Sometimes we're talking and a little spit comes out of our mouth and lands on the other person's nose. How do we increase a tolerance for not knowing exactly what's going to happen? We still plan, but we can't know for sure.
And I think what makes it so hard, at least in this population, is that not only are children anxious, right? They have that
Mm-hmm.
bias, that
Mm-hmm.
inhibited temperament. And parents often have it as well. There's that
Mm-hmm.
large percentage of, parental anxiety from the genetic and learned components,
Mm-hmm.
but they have the the communication challenges. So
Yes.
they may just go out, but it's where are they in terms of their comfort and communication. So you're
Mm-hmm.
not just dealing with the anxieties of what's going to happen when, but it's their communication on top of that.
Right.
So it's a very challenging situation